Hello, everybody. I'm just waiting for a few more people to come into the chat. We've just opened this webinar on Valentine's Day, 14th of February, Surviving and Thriving in Midwifery. Welcome, everybody. Good morning, good afternoon, good evening. Welcome. I can see more and more people joining the chat, showing love for midwives. So when everybody's sitting comfortably, we've got everybody in the room, I will begin. I myself am here with esteemed colleagues today, coming to share their own experiences of surviving and thriving in midwifery. Today, we hope to gain some of your insights as well as our own insights in making sure that we have a world view on this and how we can really celebrate midwives today. And as it's Valentine's Day, really thinking about how we can survive and thrive and show love to the midwifery profession on Valentine's Day. So I know there's been some excitement around this webinar, so I'm excited to get going. We're getting more and more people joining the chat, more and more people joining the room. Please feel free to use the chat facility if you wanted to introduce yourself, where you're from. And if you can't use your microphone throughout the session, perhaps you could use the chat function to still share and collaborate in the session. We'll also be sending you off to a couple of other links to share your ideas more formally, so we can start to collect some data on what you guys are thinking and how you guys can contribute to the session. So as I said, welcome, good morning, good afternoon, and good evening to everybody joining the session. My name is Dr. Sally Pizarro, and I'm here leading the session on surviving and thriving in midwifery, sharing our love for midwives and midwifery on this Valentine's Day. And I'm here joined by a few esteemed colleagues that I'd like to have them introduce themselves to you. Harriet, could you please just introduce yourself and say hi to everyone just as we start the webinar, please?
Hi everyone, happy Valentine's Day from wherever you are. I'm so glad to be here. My name is Naiga Harriet. I'm a midwife from Uganda. I'm the founding director of midwife-led community transformation, MILCOT, a community-based organization that is aiming to bridge the gap which exists between the midwife and the local community through provision of sexual reproductive health and rights to marginalized adolescents and young adults. And we focus on prevention of teenage pregnancies and unplanned pregnancies. I'm a Nursing Now Challenge champion with the support of nurses. We do support nurses in the community in leadership and also giving them support to advance their capacity in provision of adolescent-friendly sexual reproductive health. I'm so glad to be here again.
Thanks very much for that short introduction. We'll be hearing more from Harriet later as she takes us through how she's survived in adversity and thrived through the development of MILCOT, which, you know, I know you're going to be inspired to hear later. Can I also ask Michelle to come off mute and introduce herself so that we can just establish who's here at the start of the webinar, please?
Hi everybody, happy Valentine's Day. My name is Michelle Holden. I am a community midwife in Essex. I am newly qualified as well, 2019 I qualified. I'm a community midwife and I lead on our antenatal education and hypnobirthing at my midwife-led unit that I work out of.
Brilliant. And again, you'll all be hearing from Michelle in a little while as she talks about her experiences of surviving and thriving, obviously in difficult times as a newly qualified midwife, joining the profession and thriving in spite of our challenges. We also have Pat Denny with us. Hi, Pat. Pat's going to do some sessions with us at the end of the session. Could you introduce yourself, please?
Hi, everyone. Happy Valentine's Day. My name is Pat Denny. I'm the CEO of Health Action Training, which is a training company. We do courses related to coping in crisis and so forth, and associated with Nursing Now Challenge. And these are open to midwives as well. And I'm here, I'm based in Northern Ireland and a city called Derry. And I'm here today to actually do some breathing exercises with you that midwives who did our courses found very valuable, both for themselves and for their mothers.
Thanks very much, Pat. So the reason we wanted to get everybody together today was not only because it's Valentine's Day, show your love for midwives, but also to think about how we can survive and thrive in midwifery in challenging times, both past and present. I know so many midwives throughout my career who have survived adversity, including myself. It might be through bullying or through traumatic incidents, or you've seen something you wanted to do in practice, but you've not been able to do it, but you've overcome that barrier and you've thrived in spite of it. And midwives are really kind of empowering with their stories and how they've done that and how they've empowered and inspired others to say, yes, you know, when the going gets tough and when you're challenged with something, you can survive that. It's not always the end. It's about you surviving and then thriving. Not that we should have to survive and thrive, but we do. And so this is really about thinking about how we might do that and how we might take inspiration from ourselves and each other in that. But also with this session, I really wanted to, with this Midwives in Focus project, we've been doing lots of activities where we've, been talking to you about what we were thinking and telling you about the projects we're excited to do. But with this, we really wanted to invite you to contribute to us, your thinking and your kind of contributions in terms of how you survived and thrived. So excitingly, we have myself and a colleague, occupational health psychologist, Karen Mayer, who is an occupational health psychologist. We had the opportunity to write a book about how we might survive and thrive in midwifery, drawing on all different aspects of that. And we didn't just want to write it from our own perspectives, we wanted to have the perspectives of other midwives around the world. So in the chat box, we're going to be putting throughout the session and beyond the session a link to a form where we're hoping that you will add a sentence or two just about how you might have survived and thrived as a midwife. So it might be something like, I was bullied by colleagues, however, I survived by standing up for myself and what I believed in. Something like that. So you talk about a quote about where you survived something, you've been a whistleblower, or you've been challenged in providing quality care in challenging circumstances, but you've overcome it in terms of what you did to survive that and thrive in spite of it. So that's the kind of thing we're looking for. And if you go to that form and you put in your comment, we will choose as many of those as we can that are appropriate to add to the book. So if you want to add your name and the country you're from, you can equally do it anonymously, but if you wanted to add your name and the country you're from, then we can properly credit you in the book for how we've used your example to hopefully inspire other midwives who are going through challenging times, challenging circumstances. We will be asking a few other people to give a little bit more in terms of their own experiences, but considering the number of people in the session and the number of people we're hoping to reach, unfortunately, we will have mostly just a little bit of room in the book for as many quotes as possible. So try and be concise in your thinking, but if you can contribute to that link and how you survived and thrived, that will be open for quite some time, that link. So hopefully you'll have some time to look at it. And then towards the end of the session, we'll be asking you for some other data collection as well. But the book we're looking to write is called Surviving and Thriving in Midwifery, and we're hoping to launch it at ICM, so the International Confederation of Midwives Conference in Bali in 2023. So we're inviting as many midwives as possible to contribute to that form. The link doesn't open in the hospital setting, someone says, could it be emailed? I'm sure we're going to email it out to everybody in the Nursing Now network, who definitely are professional networks we're emailing it out to. So hopefully we'll be able to do that after the session, so that everybody can take their time over the next few days to contribute to the book and get themselves named in the book and how they've survived and thrived. Equally, you can stay anonymous if that's your preference, that's fine. So welcome everybody. We're going to hear from two speakers now, our two speakers, on how they've personally survived and thrived in midwifery. And after that, hopefully we'll be able to have a bit more of an open discussion involving you, unmuting yourselves, and if you're willing to share about your own experiences of surviving and thriving, then we can have a bit of a conversation, a little bit of a think about how can we thrive, why do we survive, and those kind of things after the session. So I'm going to hand over first to Harriet, who's done some really inspiring things in the face of adversity, wanting to do something, wanting to survive where she was challenged and overcome those barriers to thrive. So Harriet, I'll hand over to you and your inspiring story now, please.
Thank you very much, Sally, and hi everyone once again. Well, a midwife works in a challenging environment, especially in the developing world, especially with the diversity of limited resources. But if I can throw back my story, when I chose to start midwife-led community transformation, I started because I saw a problem where marginalized adolescents and young adults could not receive what they need. They lacked sexual reproductive health information, and so they faced complications that can be prevented. And because I had much passion with these young people, I had a burden on my heart. I had a burden and I couldn't do anything else apart from solving this challenge, and started midwife-led community transformation to come to the community, to be able to get close to these people who need me most. And that is where I can start sharing the challenges that came along. Of course, as a young midwife who was very enthusiastic in helping, I was doing charity, and I left the jobs, as in I chose to do charity, to give it enough time so that it can prosper. And so I wasn't getting salary. And up to now, I'm not getting monthly pay. And that is a big challenge. And then also the limited resources that at first we didn't have any funds to support these girls, because what we do is providing them with sexual reproductive health information services, and then also survival skills like life skills, vocational skills, so that they can be able to start up small scale businesses. But at first we didn't have any fund, but it was so challenging, and to survive and thrive, it's only me who knows. I believe people saw me. Well, it is so hard to look for resources. I remember when the pandemic came and everyone was pressed hard, and the marginalized adolescents were really facing it hard. And because we do train them from the center, so now when the pandemic came, they couldn't get anything to eat because we provide them lunch. And they also do petty jobs within their communities, for example, washing clothes, and they give them money. But during the lockdown, they couldn't do all those things, but instead they could stay home. So now I was in my house, and I wasn't well at that moment. This is just a story. I wasn't well at that moment because I had lost my lovely grandmother during COVID-19. And when she passed on, I didn't have an opportunity to travel and celebrate her life. Or even my relatives couldn't go. So I wasn't fine as a person in my life, despite being a midwife. And then on top of that, also other relatives were sick. But leave alone all those problems, I had girls knocking my door because they were looking for support. And when I opened the door, I just saw the sad faces. And these girls said, "We are dying of hunger. We have nothing to eat." And I said, "What can I do?" And I had to portion part of some of my food that I had stocked so that I share with them. At that moment, we did not have a relief fund to buy them foods and other stuffs. So they went and they were able to cook for that day, and they ate food. But in this, I want to say that when I shared love and compassion, I felt a little bit happy, despite I was in a crisis. When we are in the crisis and we have people around us, the only thing that we have is sharing love and compassion. And that can make us survive at that moment. And then to thrive, we need continuous love and also finding our strength through the crisis of limited resources. I'm centering on limited resources because organizations without resources, it's really entirely hard to move. When we lack resources, we bring our strength together as a team. So that means I bring the skills of team building so that we synergize and find out how we can gather resources together. So we got the funding from Badet Trust and other organizations, and we were able to support the nurses and midwives who were also going through hard times. So that also gave me joy, because my wish was that if I can do something, when you have something pushing you, when you have a vision, when you have a purpose, the crisis might not affect you so much as a person who is just moving without a vision. Because within the crisis, and you have a vision, you can easily mobilize yourself and find your inner strength that you can stand. So I had to stand throughout. In my life, I do stay at the center because we haven't yet got enough funding to support us. But staying at the center is also not easy, but you do the work when you have joy, when you have self-satisfaction, because you do something that you really love. Because midwives, we were called to serve. When you do what you have to do, you really feel happy. It's so fulfilling. It's just amazing to do the work that you think satisfies your heart. So I have pulled out being compassionate, sharing love, knowing your strength. I have really have this unending hope. It doesn't die, because I know that there is always something better if I work hard, if I utilize the team that I have, if I identify everyone's strengths and bring it on table and we do something. That has been so amazing for me. And I think it is the one that will take me forward, and it is a thing that can really help someone who might be starting something or is struggling with limited resources, is building a team, and also having skills in leadership. Everyone is a leader as midwives, because you find yourself on the ward and you are everyone is looking at you. Everyone is looking at you. Everyone is calling you, for those ones who are in clinical environment. And even in the community, people are looking at me. So in that way, you are a leader, whether you want or not. So that means you have to lead from the front. And as a leader, you do not run away from the fire, but you do enter the fire. So that has kept me strong always, that even when we are in the crisis, everyone is looking at me. So how can I fall? That means I have to stand. And then cherishing in the achievements together. Despite the amount of achievement, however little it is, you have to be happy for it, because it is taking you somewhere, and you are going to be able to utilize that achievement to go to another step. So as I have moved a long way in my journey, I and my team have received achievements. We have been recognized and awarded as the organization of the year with the Award of Excellence in Advancing Maternal Healthcare in Uganda. We had an achievement of meeting the Duchess of Cambridge, and we have had an opportunity of being empowered by Nursing Now Global Campaign. We have had an opportunity of being empowered by the International Confederation of Midwives. And these, because I have taken them as very important achievements to utilize them, so they have put me to another level. Right now, I'm also a member of the Partnership for Maternal, Newborn and Child Health that is hosted by WHO, and I'm a member of the Accountability Working Group, where we do provide the strategic guidance and accountability in women's, children, and adolescent health around the world. But what I mean is cherishing in the little that you have achieved and utilizing it to capitalize it is something that can also take you to another level. So that means when we are in the crisis, doesn't mean that we cry and do not have the energy to speak out. We have to advocate for ourselves. And the good thing is, as I wind up, the good thing is there should be a problem that really pricks us to do something. If there are no challenges, how would the world be? What would we yearn for? That means we have to see the crisis as an opportunity. I have seen the crisis as an opportunity. When the pandemic came, everyone has to be thinking about which ways can we adopt to get back to normal? Can we stay doing things the old way? So that means the crisis is an opportunity. Every crisis, be it loss of loved ones, be it what, you have always to find an opportunity within that crisis. And that is how I have taken my crisis, my wind that has been blowing me, because we have a saying that in my culture that wind blows those who are standing. Wind blows those who are standing. When you feel that you are too challenged, know that you are the one who is standing and you're the one who is strong. So that means you have to push hard and achieve something that people will look at and say, wow, we are inspired. Thank you so much. And that's how I have ended up being inspiring to many nurses and midwives around the globe. And I'm also still yearning to achieve many more achievements, even with this crisis. Thank you so much, Sally. I hope that was helpful.
Thank you, Harriet. Yes, always. I never get tired of hearing your story, and also thinking about, and every time you share your story, you actually share a little bit more. You actually share more wisdom, more insights. And I think that's because you're constantly developing and learning as a leader and as a midwife, because you're always thinking of those opportunities. And I think that that's really important. And when you're in that space where you think, oh, can I ever do this? It's just hopeless. I'm only talking about the problems, never thinking about the solutions. I think it's really important to say, actually, you know what, in every crisis, there is that opportunity, and we can't be problem focused. We have to be solution focused in everything we do, in order to take things forward. And things can feel very kind of like we are just surviving, but ultimately we are thriving in this. So I've had lots of people writing in the chat as to who they are, where they're from. We seem to have a very, very broad range of people in the room from lots of different countries, which is exactly what we're looking for. So that's brilliant. I do see some people with their hands up, and we will be having a Q&A session, discussion session in a bit. We've had people in the chat saying that they're writing things on surviving in midwifery, which is awesome. The more the better, really. Other people saying, Harriet, you're an inspiration, thanks for sharing. And also we've got about 40 participants in the chat, but that in the session, but that often comes under numbers there. We usually see a lot more, and also this is being recorded and it will be shared after the session, so we'll have even more people hopefully tuning in at different parts of the world where the time differences might not match, etc. We've got more people saying thank you, Harriet, very powerful speech. I think we're having some people going to the book to kind of maybe be inspired a bit more about how they have survived and thrived, writing a couple of sentences for the book. to make sure that their contribution is there. I've actually asked Harriet to write a little bit more in the book because her story is so inspiring, and obviously she could never fit all of that into 1 or 2 sentences. So I've actually been asked Harriet to add a little bit more to the book so that more people can be inspired by that story around the world when this book is published. But every single contribution you make, every little sentence, tidbit, idea, tip you can give other midwives is going to be amazing for this book, so we can kind of get that global representation of midwives in terms of sharing. And saying that, we have Michelle coming next. Now Michelle is she says she's newly qualified, but she's not that newly qualified. But we all remember what it was like to be a student, newly qualified midwife, etc., thinking, where am I going to go in my career? How will I ever achieve all those big things I have in my heart to bring? And so I think it's really important to remember that we were all students once, we were all newly qualified midwives once. But I'm going to invite Michelle now to talk about how she's personally surviving and thriving in her own situation at the moment, and then afterwards we'll go on to answer some questions and address people with their hands up in the chat. So welcome, Michelle.
Hi, thank you, Sally, and hi everybody, and happy Valentine's Day. And thank you, Harriet, for that really inspiring speech. I don't know how I'm going to follow that with my little newly qualified story, but I will try. Thank you. So as I said, I'm Michelle. I'm from Essex in the UK, which is about 50 miles east of London. I qualified just over 2 years ago now, October 2019, just before we were hit by a global pandemic. So I just wanted to kind of talk to you all a little bit briefly about what I found kind of really challenging in my first year, 2 years as a newly qualified midwife. And I think, you know, you spend a long time, 3+ years, you know, dreaming of this job and working incredibly hard as a student, you know, ready to qualify. And as I said, you have these kind of big dreams, and you get there and you get pushed out of the nest as it is, and it all kind of hits you all at once, that questioning your knowledge and can you trust your intuition? You know, you don't always have that, you know, wonderful qualified midwife to kind of fall back on anymore. You are that person, and these women, these families, they see you dressed in your uniform and they trust you. They hang on every single word you say, and that can, you know, be really difficult as a newly qualified, really kind of having that confidence and almost having to sort of fake that confidence at times, that kind of you know, that knowledge is in there, you know it, but kind of putting that across and portraying that to women can be so difficult. And I wanted to speak a little bit about that kind of theory practice gap, because that's what I think that I found really, really difficult, and kind of probably caused me the most conflict. We know what should be done. We know how to do it. We've read it in the textbooks. We've written it in our exams. We have talked about it over and over again. But when it comes to it, there are staffing issues, as I'm sure we all know. There are time constraints. There are, you know, all of these other kind of conflicts that kind of come in the way, these reasons why we can't provide this kind of dream, this wonderful dreamy picture of midwifery that we sort of had in our heads. And we put pressure on ourselves, and that's when we do start to question ourselves, definitely. And then a global pandemic comes along as well, and I think I found that kind of pre-COVID, the wonderful team that I do work in, you know, I felt very much that I could kind of go to them about anything and they would always have the answers. They were this kind of oracle team. I was sort of the newly qualified midwife, and these midwives had been working and practicing for years and years and had this wealth of knowledge. And all of a sudden, none of us had any knowledge on COVID. None of us knew what was coming the next day. None of us had an idea of how we were going to get through and what the next update might bring, you know. So I think, and again, this falls back on what Harriet said, the way that we thrived was that we came together as a team. And I think teams are just so important. You know, having the right team gives you the confidence to speak up. It gives you the confidence to say, actually, I don't know what this is. Can somebody help me? And when you feel safe in a team, you feel safe to share that. You feel safe to cry and get upset and be negative, knowing that there are people there who understand you and who will kind of bring you back up and will give you that support. And we, once the pandemic kind of hit the UK, we came together as a team, and we really decided that we needed a joint vision. We met every week we're just a small team of 12, and we met every single week, whether that was Zoom, some of us would be face to face, some of us would just be on the phone, but we came together because our leader really felt that we needed that joint focus and that joint vision. And we came up with something that we had printed off and put in all of our rooms to remind us all, and that was our head, heart and hands. And we decided that we wanted to focus on that, and our head is our innovation and being curious all the time, and our heart is about our compassion and drawing on experiences together and thinking about everybody else, and our hand is our productivity and our activity. What can we do to hold hands? What can we do to kind of bring our head and our heart together? How can we work as a team? And this kind of shared vision really allowed us to thrive, because anytime we felt like we were questioning what we were doing, we kind of brought it back to this head, heart, hands vision. And we thought about, what can we do to be innovative? As Harriet said, what can we do in this? What positive can we find from this? You know, this is tough times for everybody, for professionals, for women, and what can we do to kind of draw that together, and what positive can we bring from that? So we really kind of focused on a goal to bring us together. You know, how can we overcome these challenges? So we looked a lot at new digital services that we could provide. How could we provide that? What is best for the families that we care for? How are we going to reach them? How can we make those families feel supported? And, you know, going back to our basic midwifery care, again, to kind of highlight what Harriet said, we are here to care for women. That's why we do this job, because we care about women and we care about families. And what can we do to kind of pull that back in? Let's keep thinking about that. How can we draw everybody together? And when you have a positive team that focuses on a vision, and you all have that shared vision and you come together, that's what we found really helped us to thrive, that leadership, that vision, that joint working. Because I think, you know, singly, as a single person, that's great, you can kind of change the lives of one or two people, but as a team you can change a whole community, and that is just, it's just incredible. So yeah, thank you.
Thanks, Michelle. That's awesome. I was just thinking, like, you say that obviously it's coming together as a team, and you talk about your leader, like our leader suggested this, etc. Do you see yourself at this point in your career becoming that leader yourself?
Yeah, and I have told her this on many occasions as well. That leadership that we have was just incredible, and she is so incredibly inspiring, and she is now helping me to go through different kind of leadership channels and leadership training. And I think having someone to look up to pushes you to be better, and having someone to inspire to pushes you to be better in yourself.
Yeah, so having that person to look up to, but also being that person to look up to, because there's always someone who's going to be looking at you at the same time. So that's awesome. Thank you so much, Michelle. It's great to have the two perspectives, and I'd love to have more from different parts of the world as well. So we've just had more people in the chat saying good evening, this is great. We face the same problems. This really helps. Inspiring to hear both of your experiences, and anyone who's just come in the room, we're posting in the chat now a link, which is if you can share your experiences very briefly of surviving and thriving. So maybe you had an issue with whistleblowing and you said, despite whistleblowing, I survived, the challenges that come with that, and I thrived because I managed to come to work in regulation and make sure it happened. Those kind of things. We'd love you to follow the link to share those experiences in a book we're publishing about surviving and thriving in midwifery, and having those little excerpts from midwives all around the world will really make it a global collaboration of voices coming together to do exactly what you said, Michelle. Be that inspiration so that someone can take strength from that and either use it to empower themselves in terms of surviving and thriving, or use it as an emulative model to say that's how I want to be, or that's how I can do things. So it's not about sitting there and taking it. It's about saying I can do this, and thinking back to Harriet's story, actually just saying I need to do this. That I can't wait for anyone else to come along. It's me. No one's going to save us. Let's do it ourselves. So we've had one more comment from Gila. Thank you so much, Michelle. It's really important to show young/new, because new doesn't always mean young, midwives, that years of experience does not equal lack of voice, motivation and strength and leadership. Exactly, it just has no boundaries in terms of that. So I'm going to open up now the floor a little bit. While people might be contributing to the book and writing little bits there, if anyone wants to speak and share their personal surviving and thriving stories or comment on what's already been discussed. I see Halimo has had a hand up for ages. So Halimo, do you want to come off mute and come on camera to talk to us if you can, please? I see you're on mute at the moment, so you might need to unmute. If you're having technical issues, we could go to someone else while you sort those out and come back to you. I can't hear you at the moment. I see your hand up. Just take yourself off mute, Halimo, and then we'll try and hear you. I don't think I can do it manually. Okay, while we wait for Halimo to get technical issues sorted, can we go to Nala, please, who also has a hand up? Hi, Nala.
How are you? Hi, everybody.
Good, thank you. Welcome.
Thank you. Network is very bad signal, and we I could not open the camera. I'm sorry. Hopefully next time. Hello, can you hear me?
Yes, we can hear you. What did you want to ask or comment on or share?
Yes, I do agree with the book you would like to publish for a lot of stories globally regarding the surviving and midwifery. For me, as the president of the critical care nursing, as well, I'm teaching the midwives and the critical care areas, labor room, theaters, general for the IPC in the critical area for sepsis, for some skillful. And also, and I was holding, I was the first initiative of the Sudan Federal Ministry of Health, COVID-19 isolation and treatment center. And I'm totally agree with what Michelle said. I'm working 1 month, day and night as IPC, head of department, as well as focal person. And each time I manage not to let anyone violate the rules of PPE or crossing the red zone. And that transport the reporting, like after 6 weeks, I don't have any outbreak between all the medical staff, the healthcare workers. As well, I'm TOT for healthcare workers for COVID-19 activity and case management. But what I noticed that we do have a lot of stories. We do have a lot of stories in the maternity hospital. Mother came with COVID, not recognized, and when they recognize themselves not aware, and that time, at the beginning of the time, even if it's not being nominated as a primary hospital set to welcome the COVID. Only in the initiative time, I'm sure you will find more stories like this in other countries, especially low-income countries. So my suggestion to you, I do agree with chapter of in every country in the book for surviving and midwifery problems, because that problems already it is a long back. Now we have to come with it globally. But my suggestion, we do need to have one book for how mother recovering during the COVID-19, because the management came from all things, so from wife, from IPC, from consultants, and from ambulance services. So we need to know that story, because that story is going to give us new skills when we are going to highlight a new curriculum of COVID-19 or any pandemic to teach the nurses or the midwifery in the future. And that is highly needed, because still we are in pandemic course. We don't know what will happen for tomorrow. But my suggestion, we do need interim book with that book. That book, because there is an all problems, but this book is specific only for COVID-19, because the story will be from different things. The stories will be regarding how the mother lost, the pregnant mother during labor lost their life because of the people afraid of COVID-19 and they are not aware of it, or they hear the story that you are feeling positive and they are not on full treatment because they don't have a supply. So there is an issue like this is going to support us for teaching future nurses and midwives. As I know the code for
Nala, I think that it's getting more and more difficult to hear you, unfortunately, Nala.
Oh, so you didn't hear all what I said?
We heard some of it. That was very clear what you just said then. I heard some of it earlier on, but the technical side was kind of patchy.
Yes. Okay. So what I mean, we do agree to have the chapter. Each country to write in the chapter like one story for cerebral and midwifery problems. But what I suggested, we do need to have another book for COVID-19.
Yes, no, I got that absolutely, and I also understood your kind of need to have like a global focus on this, because it's kind of a global pandemic. It's a global thing that's happened. It's a global midwifery issue that we've all had to deal with around the world. So making sure it's had a global focus. I think also you mentioned, unless I misheard you, something about thinking about our history and documenting this part of our midwifery history going forward. And I know there's been a lot around the history of midwifery lately, with the ICM putting the history of midwifery out there, and the need for history and historical grounding to what we're doing and who we are. What our contribution is really, really important for surviving and thriving, because it gives us that sense of belonging about collectively who we are as a global profession, delivering maternity midwifery care around the world. So thanks very much, Nala. Someone else has put in the chat, my PhD, this is Halima. My PhD focused on midwives' experiences of workplace adversity and resilience in northern Nigeria using a constructivist grounded theory. My own PhD focused on much the same, thinking about workplace well-being, workplace distress, stress, burnout, those kind of things, and thinking about how that might be sort of addressed going forward. So I'd love to see you contribute a little bit on the form to the book about how you think we can survive and thrive in midwifery. The form's just gone on up there. And Halima again saying it saw how midwives survive and thrive through their workplace. So that would be amazing if you could give some examples of how you've seen midwives survive and thrive in Nigeria with your own PhD there. If you can share that with us, then we're very happy to cite you and your work and make sure that you're credited for your contribution, because I just think that's really, really important to show in those pockets of the world that we don't always hear from, to make sure it's a global approach here. Halimo, I don't know if you've got, you can come off mute, your hand's still up. If you could take yourself off mute, we can hear you. No, is anyone else willing to put their hand up and contribute to the conversation? I know that there's so many different ways in which people have survived and thrived. Myself, I got very ill in practice clinically working, and then sort of survived that, even though I lost my professional registration for a while, had to get better and come back. Now working for a regulator, I see many, many midwives and nurses coming through those cases where you see how they've had to survive in very difficult personal circumstances, work-based circumstances, and then they've had to relearn how to survive and cope with that. And then after that, thrive in terms of thinking, how do I use this to empower myself to do new things, empower others to do new things? I think we've got another couple of people put their hands up now, which is amazing. Gila, did you want to come off mute and contribute to the conversation?
First of all, thank you so much. You're both so inspiring, Harriet and Michelle. It's so amazing to be here and hearing your stories. And I really loved everything you said. I think that COVID-19 is an incredible example of midwives thriving and surviving. Personally, in Israel, when we saw the wave coming and our ability to innovate and adapt instantaneously for things that we didn't know were happening, meaning we were prepared for one scenario and suddenly we had a room for one woman and we suddenly had to be prepared for 5 positive COVID-19 women. And the way that we were able to not only survive, but thrive, in the sense that one of the things that I hope to publish, I hope soon, is the fact that the people who treated these women were exclusively midwives. There were no physicians in this ward that we built for these COVID-19 positive women. And to show that not only did we survive, but these women thrived, these women who were ill and received one-on-one midwifery care throughout the entire pandemic. And there were less cesareans, less vacuums, less interventions, less bleeding, less epidurals, less complications. We can take something that is potentially a global pandemic. And of course, I'm not minimizing the disaster of the global pandemic, but had such positive statistical significance with regards to midwifery one-on-one care that I believe is not just survival. I believe that's midwifery thriving. And I think that there are examples of that across the entire world, of where midwives stood up and we didn't run from the fight, but we ran towards it and made significant differences in the lives of mothers and their babies.
Absolutely. Absolutely, Gila. Thanks so much. We've seen so many of these stories, and I hope people are. I can't see what people are writing until we collect all of the contributions, but I really hope people are adding to that. And we're going to have some people, asked to contribute a bit more if they've got a larger story to tell or something really in depth there. So it's really a capture of people's voices and thinking about how we can give a voice to those midwives who have around the world survived and thrived in exactly the way that Gila and Harriet and everyone else has kind of commented on in the chat. I think we'll take one more, Mariama, if we can just have one more speaker, and then I just want to introduce you to some data collection activities that we want to do next with the kind of network of midwives that we've built around this, and then we'll end with some kind of calming breathing exercises to show our love for ourselves and one another. So Mariama, can you take yourself off mute, please, and please speak?
Hello, good evening, everyone.
Hello, lovely to have you here. Yes, we can hear you.
Oh, okay, that's fine. So my name is Mariam. I'm actually logging in from Qatar in the Middle East. I'm a registered nurse and midwife from the UK. I'm originally from Sierra Leone in West Africa. Thank you so much, Harriet, Michelle, and everybody here tonight for such impressive contributions on thriving and surviving as a midwife. My comments here this evening is just to share with you, how, experiences of thriving and surviving as a midwife in an obstetric-led environment. That is actually a huge, huge, huge challenge. I mean, coming from the UK as a midwife, where you are an autonomous practitioner, you basically do your assessments, and a woman can be pregnant up to the time they deliver, go home without seeing a medical practitioner. Coming into an environment wherein you have everything medicalized, every decision whatsoever have to be made by the physician. It's just so different. And at some point you just feel like, oh, what am I doing here? how am I going to survive? How am I going to actually thrive in such an environment where interventions, unnecessary interventions are just, so scary. So to cut the long story short, we are employed to actually come and develop a midwifery-led care model. In the first place, I'm working in a small facility, a secondary facility, hospital, with a birth rate of just over 2,000. And with a whole workforce of 147 nurses and midwives, we have only 16 midwives. How are you going to implement a midwifery-led care model when majority, 80% of the workforce are nurses? So everything you say, everything you want to implement is looked as, you are being looked as a troublemaker. That's one. Two, the physicians themselves feel that you want to take their job away from them. It's so strange. You see physicians sitting in rooms, antenatal clinic, doing bookings, doing follow-ups for low-risk pregnant women. And you're like, where should I start? But the whole thing, what I'm learning from the whole thing is, I'm not going to just leave because I'm not in my comfort zone. Because when you move out of your comfort zone and actually thrive and survive in an environment that is so strange to you, that is what makes you that person. That's what makes you that compassionate individual. And that's what makes you a professional midwife. So for me, what I'm always saying is, it will take time for everything that we want to implement to come to fruition. But however, even if it's one thing you manage to achieve at a time, that's something for me. And your name will always be in the history that you were one of the people that actually started. So we might not have a midwifery-led care come to fruition now in the next 2, 3, 4, or 5 years, but you will always be down in history. And you just have to continue pushing. You have to continue walking around people. You always have to negotiate to actually meet in the middle, so that they will be able to actually take on board some of the things that you want to implement. So thank you so much for listening. I don't want to keep your time, but use most of your time. But these are just some of the challenges that we face in the Middle East, but we are trying to survive and thrive. Thank you.
Thank you, Mariama. That's really interesting. I love the idea of a legacy. You're actually creating a legacy if you're the first midwife to do something, or the first to take a new initiative forward, because you don't want to just survive, you do want to thrive. So I really hope you contribute to the book, just a little bit about Qatar and the challenges you face there and how you can survive and thrive in that area, because that would be really inspiring, not only for midwives where you are, but midwives around the world. So we've only got a few minutes left. As I said, I've really tried to push the fact that we really want you to contribute to this book, a little sentence or two about how you survived and thrived in midwifery, or how others have survived and thrived in midwifery, where you are in the world, and putting your name and country to that, or just your country if you're not comfortable putting your name to it. And we'll be able to publish that in our book, and make sure we have your experiences heard. But as we come to the end of this session, I want to launch another data collection activity we're doing, which is a survey we're doing from Coventry University in partnership with Japigo, where we've got ethical approval to collect data in relation to what shows strong midwifery leadership, how we could explore our professional identity, and also how we want midwifery to be represented to the world, and how we might make that happen, or what it looks like. So the survey link's just been put in the chat now. Thank you very much. And we'll be sharing that with you over the next couple of months to make sure we really capture as many people as possible as we can in that survey. And that's a global survey. So please share that with your networks wherever you are in the world. We want as many midwives as possible around the world from as many different countries as possible to talk about their professional identity, what they think strong midwifery looks like, and also how the midwifery profession might be best represented to the world. How do we want to showcase ourselves? And that's going to turn into real life answers to challenges that we see in the world. So hopefully you'll be really active in contributing to that and sharing it with your networks. But lastly, on this Valentine's Day, as we show our love to midwives and midwifery around the world. I'm going to hand over to Pat Deeney, who can help us to show that love through some breathing exercises to end the session. So thank you, everybody.
Okay, thank you, Sally, and as I say, happy Valentine's Day to everyone. At Health Action Training, we use methods from actor training to actually help healthcare professionals centered and become more person-centered and develop more self-caring. And I was particularly struck by what Michelle said about hands, heart, and head. We have a great improv game for that, Michelle. I must talk to you about it. And it actually involves the use of a spring and how you can actually walk around the room being pulled by your heart or your head, and then you can look more deeply at your hands. But I've simply 2 breathing exercises here. Both of these are from a book by a famous person called James Nestor, and it's called Breathing, the Science of the Lost Art. And I would recommend that you would Google that and maybe get the book. But the 2 exercises, the first one actually is related to nostril breathing, and the second one is related to box breathing. So the 2 the first one is nostril to nostril breathing, and this you sometimes would require a tissue, or certainly you might have to sanitize your hands after it, maybe, but certainly would not be something you would do when you're wearing your PPE. But it could be very useful before you put on your PPE or after you come to the end of the shift. And this one requires you to actually hold your thumb up and push your thumb against one nostril. And that's, thank you, Sally, for doing it, yeah. And what you do is you breathe in the nostril that's actually open and breathe out again. And then what you do is you take your middle finger, your ring finger, and you hold the other nostril and you do the same. And you change around. And when you're doing that, you should think about the position of your shoulders. You should really extend to get full lung capacity. And so you're using your thumb, then your ring finger. And if you do about 20 of those, I can guarantee that your heart rate will drop. It's as good as any beta blocker. The second breathing exercise is related. It's called box breathing, and this one is easy to remember because what you do is actually, again, you position yourself properly on your chair, and this could be something when you're sitting in traffic even, and you pull your shoulders back, make sure that you almost like try to imagine that your shoulder blades or your clavicles at the back, you almost like want them to touch each other. They can't really, but you should try to do that. And what you do is you breathe in for 4, you hold for 4, and then you release for 4. So you breathe in 1, 2, 3, 4, hold for 4, 1, 2, 3, 4. Breathe out for 4, 1, 2, 3, 4. And that breathing out is really critical because that's getting rid of all the carbon dioxide. It's sort of clogging up your cells. Okay, and you can breathe in for 4, 2, 3, 4. Hold for 4, 1, 2, 3, 4. Breathe out for 4. 2 more times. Breathe in for 4. 3, 4. Hold for 4. Breathe out for 4. Last time. 2, 3, 4. Hold for 4. Out for 4. And I always encourage people, that's breathing in for 4, hold for 4, out for 4, and do it 4 times. And even after that, those 4 cycles, you can do it for as many cycles as you wish. It's very, very good to help you sleep. but what you find is you're slightly more centered and more relaxed. So you actually, then you're able to have a good yawn, And I want you, even though it's the middle of the day for some people, it is the evening for others, it's the morning for others, I want you to just yawn. Give me a good yawn. And stretch. Another big yawn. And so in some cultures, it's, you know, it's rude while people are talking, they're yawning. It implies it, but really yawning is a natural thing that the body does when it has to adjust the gas exchange. So it's really important to do it. So that's all remains for me. Sometimes you should create some time to do those breathing exercises, and I would encourage you always to take a few minutes of, like, you can combine them with your meditation or whatever, but it's important moments of self-care is an appreciation of yourself is probably most important. And just if one last point, if you don't mind, Sally, when it comes to resilience, I would be very influenced by a lady called Jeanette Poole. She's actually from England, and she runs a company, and you probably know about them. They're based in York. But she asked you, are you a tennis ball or are you a tomato? And it's important when you come to think how you're coping, you think, am I a tennis ball? That's something that bounces back really easy. Or am I a tomato that I crush and fall apart? And the important thing about the tomato is, if you think about it, when you crush the tomato, look at how many seeds are coming out. Look at how many seeds are coming out and lots of growth after it. So it's a great metaphor. The tomato is actually also a way of coping. So thank you very much.
Thank you very much. That was a great way to show midwifery love to ourselves and each other, just giving us that 5 minutes to just recenter, regroup, chill out, and focus on ourselves. So thank you very much, Pat. So that brings us to the end of this session, this Valentine's Day on surviving and thriving in midwifery. We've asked you to do 2 things. One, contribute to the book with the links in the chat, and one, contribute to the survey and share the survey. You can share the book contribution as well if you know other midwives who have something really, really powerful to share. But other than that, I will leave you to your Valentine's Day and leave you with my love and everybody else's love from the group. So with that, thank you very much, everybody. I put my email address in the chat. I will see you next time. Thank you.